Hello, everyone, and welcome back to the Beauty Topics podcast. I'm your host, Chantel, and I have an amazing guest with me on my couch today. I have Miss Lauren Doherty, and she is someone that I met. She actually booked me for hair and makeup for family portraits, and I'm extremely nosy, and I love to get to know my clients. So I want to know, what do you do? What's going on? And she started explaining to me about her therapy background and how she helps women and teens and girls. And it just really resonated with me, being a mom of, two girls. I have a 21-year-old and a 17-year-old. And just listening to her talk about what she did and her passion for it just really inspired me to have her come on the couch today so we can kind of just talk a bit about mental health. So I'm very, very excited to have you here, Miss Lauren. Thank you so much for coming.
Thank you for having me, and thank you for making mental health a priority, because it's an important topic. And so anytime anyone asks me to talk about it, I'm in.
I love it. And apparently she just shared with me that this is her first podcast.
Yes, it is. My first podcast.
I'm so honored that I get to be number one.
Yes.
You just don't even understand how excited I am to have you here, because I feel like so many times people kind of feel like, sometimes it seems like there's a stigma around therapy. They're like, oh, if you go to therapy, you're crazy. I'm like, no, if you go to therapy, sometimes you just need someone to talk to and bounce things off of and be an impartial ear, or be someone that's outside of the situation that can see things from a different perspective than you can.
Absolutely.
So I just think it's super important. I kind of just really want to jump into it. Did you always know that you wanted to help people?
Yes. So my story is kind of interesting. I was born with a pretty serious congenital heart defect.
Oh, wow.
So when I was born, I had multiple things wrong with my heart. I had open heart surgery when I was 2.
Shut the front door.
My parents were these young 24-year-old. They had no idea what to do. And they kind of just, they needed support, but they didn't have it at the time. Mm-hmm. So this was the 80s. And they threw me into life with my other 2 siblings after my surgery. They didn't put me in a bubble.
Oh, wow.
I kind of lived my life. Thank God. Thank you, Mom and Dad, because my heart adapted.
Mm-hmm, mm-hmm.
But from that age, I kind of just always said, okay, I was helped. I'm going to help people. And I don't even know where that came from. But my dad said from a young age, I would write, I'm going to be a pediatrician. I'm going to be a pediatrician. I'm going to help people. And he said that was like my mantra. Like, I'm going to be a doctor. I'm going to help people because I was helped. I'm going to go do all this stuff. Fast forward, I get in school, realize I like writing. I like talking to people. I like people.
Yes.
The science and math, not my thing.
I'm with you.
Not my thing.
I didn't love it. I don't love physics.
Yeah.
Okay.
Calculus, no. And so I started going in a different direction, and I realized I could read people. I could connect with people of all different kinds. It doesn't matter what background, I can find a common ground. So when I went into college, I started thinking about psychology, and that was the way that I was supposed to help people. And now I know that I was meant to help people. It just took me on a different path.
Wow. So you were always emotionally intelligent.
Yes. And I was always going to give back, because I feel like I was given this second chance. I was given this chance at life, and people needed to, hear my story. And there's more to it when I get in my 20s, which I can get into also, but it's all about, helping people. And so doctors do what they can, counselors do what they can. We all help people in a different way.
I love it. I love it. That's open heart surgery at the age of 2. I bet your parents were scared out of their minds.
They were. And now I actually like to volunteer at Texas Children's and help women who get the diagnosis that I have, because now you can diagnose it at 20 weeks, and it's done 3 days old. And it's just like I don't want to say simple. It's a lifelong heart defect, but back then there was no ultrasound. They didn't know. So now someone who has my diagnosis and they have a child going to be born with it, it's so nice to see. I'm a woman. I have 3 children. They're all heart healthy. I've had women cry and say, I cannot believe I'm looking at someone who's going to have my kid's heart defect. I thought it was a death sentence.
Oh my God.
And I'm sitting in front of them. I've lived abroad. I work out. I will have to have surgery again someday, but I live in a great state for heart care.
Okay.
So that's a really unique thing about my therapy background, is that I feel like health anxiety to me is a big thing. And so I want to keep helping other people.
I love that. I love that. It's so funny, you guys. Okay.
These dogs are cute.
My 2 Yorkies literally busted in the room, and my husband's scrambling trying to pick them up. This is hilarious.
It's okay. It's okay.
I mean, goodness gracious. Well, they're just a part of the family.
Yep.
That is what it is.
They know I'm a dog person.
They like being on the podcast couch too.
Yeah.
I'm glad that you shared that, because I was actually going to ask you, was there like a specific like event or experience in your life that led you on this path? And it was literally at the age of 2 to know and to have that type of experience so young, to where it's like, I'm sure you don't like remember it, but you're seeing it through your parents' eyes, because they're sharing what they went through. Who kind of like was their sounding board? Who helped them get through that hard time?
I think their parents helped because they were so young, but also they got the advice of one doctor who said, please do not put her in a bubble. And when they heard that, they knew they could just let me live. And the doctors have told me, like, something you did was right because your healing was great. And then my story kind of continues, if you want me to share that part about therapy.
Yes.
So I had my first baby at 29. Mm-hmm. I was completely fine about my heart. I knew it was a cool part of me. I have a cool scar. Mm-hmm. All of a sudden, I'm living in Australia and I just start having anxiety after I had my kid. Mm-hmm. And I knew I'd studied anxiety. Mm-hmm. I knew what anxiety was. I had studied it in the books. I started having it, and it was around my heart. And I was like, what is going on? I would go out in public with my little child and be holding him and think, oh, my heart feels weird. I think this is the moment I'm going to just like keel over.
Oh,
and that is a really scary, dark feeling.
Terrifying thought.
So being a therapist, I went to a therapist because I believe in therapy. And he said, Lauren, how would you not feel like that? Mm-hmm. And that's where when I realized a statistic that someone told me, 70% of people with heart defects have depression or anxiety. Mm-hmm. And I'm like, you know what? That would have been really well suited for me if I knew that, because I felt crazy. I felt dark. It was a dark time because I felt anxious. I didn't have the depression, but I felt like at any moment I would die. And that was a very new feeling for me. Mm-hmm. And so we realized together through therapy that because I became a mom, my mortality became very apparent.
Yes.
Mm-hmm. And we worked through it. And he actually had a great suggestion. He said, talk to your heart doctor about it. And my heart doctor was like, that's not what happens. You don't just keel over. And so I kind of just needed to check myself. Mm-hmm. Mm-hmm. And I also started medication, and that medication really helped me. And now I advocate, if people want to talk to me about medication, I'm an open book, because I don't think you should be ashamed of that.
No, I don't think you should be shamed for it either. If it's helping you and you need it to get through your day so you can be productive and have some peace of mind, then do it.
And at that time, that's what helped quiet that, because I do have heart palpitations. Mm-hmm. So when it happened, the Lexapro, what it would do is just quiets the voice saying, this is it. This is the end. Now, I wasn't on it forever, but that's what helped at the time.
Oh, wow.
So I think I'm a better therapist now, because I'm like, oh yeah, you had anxiety. I get it. I feel that anxiety,
Yes.
I know what it feels like, and it's scary. So that really propelled me now to do a lot of work with families with medical stuff, because I'm like, PTSD can happen with medical stuff too.
Oh, yes, for sure.
For the caregiver.
I'm so glad you like said, okay, look, I need to go talk to someone, because you didn't let it cripple you. Mm-mm. You knew something was wrong, and you're like, wait, I'm feeling this way. I have to do something. You're looking at this little baby. Mm-hmm. And I mean, for any parent, especially when it's your first one, you look at them and you're just like, I just want to make sure I can raise them and, get them to adulthood. I want my child to bury me, not the other way around. You have all those little mother's prayers, that you do. And I'm just so glad that you had the background and the knowledge to know something is wrong.
Something is wrong.
I think a lot of moms, new moms don't realize it, or they go through postpartum or something like that, and they just like punish themselves or feel like something's wrong with them. And it's like, no, it's not that. Just get the help that you need so you can kind of get over that hump. And there's no shame in it. I really feel like nowadays some of the stigma is not what it used to be in the past. How do you feel like the thoughts around therapy have changed like over the past 20 years?
I think we're lucky. I think things are getting way more normalized. So social media in that aspect has helped, because there's ways there's videos about check in with your friends, check in with your loved ones. Mm-hmm. There's a whole campaign about men checking in on each other, because men's mental health is really low sometimes, and they do not want to get help. So I think the stigma has lifted, and I think that we're way more willing to talk about trauma and talk about stuff, whereas our parents, they almost didn't think it was worth their time to do it. They didn't think they deserved it because they said, this is just how it is. We just got to keep going. But really, you don't have to keep going in misery.
Yes, that's true.
That's what I would tell someone is go ask for help. Because when I heard that 70% of people with my heart defect or a heart defect had that, I actually was like, I'm not crazy. I'm normal. So normalizing is a huge thing we do in therapy. And that makes you feel less crazy because you can feel like you're about to go to a mental hospital and then someone tells you, no, actually that's really normal. And I guarantee you'll feel about 80% better when you hear that that's normal. Sometimes you just want to hear you're normal and you're not crazy.
Very true. And I think years ago when people would go see a therapist, it was almost something they would do in secret. I remember watching a movie and she had the scarf on and the sunglasses and she's putting her head down and writing down a fake name on the clipboard so they wouldn't say her real name in the lobby because people knew her in the city.
Yep.
You know, it was.
And laying on a couch.
Yes. It was such a stigma of please don't let anybody find out because they're going to think I'm a crazy person or I might lose my job or something because I'm seeing a therapist. Yes. You know? So I'm glad, I'm really grateful about the shift. Do you think, I feel like social media, you know, it has its negatives and its positives. When it comes to therapy, I do think there are still some negative connotations when it comes to social media. Not the therapy part of it, but I feel like people look at social media and they start to get down on themselves because they'll think someone else, oh, well, that person's 24 and they have this, and this, and I'm still in school. And they start to get so down on themselves. And I'm just like, snap out of that. It's not the real world.
No,
you know,
I'm glad you brought up social media because for me, it's my soapbox because social media is affecting our teens. And I'm a big advocate for teens. And there are so many things going on with social media that we need to stop. This summer, I was at a pool and it was like a hotel pool and there was a bunch of teenage girls living their best teenage life. They were doing teenage things. And I watched one girl and she got out of the pool. She had her phone and she had Snapchat out. Her face changed. She went from like laughing and smiling to changing. And then she just had to respond to about 16 people. And she just took a picture of the floor and sent it. And I said, what are you doing? And she said, oh, I can't lose my streak. So I guess Snapchat has a streak where you go back and forth and you don't want to lose your streak. And even if you're just taking a picture of the wall that you're in right now, that's a job. Oh, you have your whole life, girl. Work is your whole life. Do not start a job now. And I watched it and I thought, that is pressure right there. And I said, well, what happens? She's like, well, it's just something we do. And her body language changed. And the other thing about social media that I don't like is where you look at it. You're alone. You're in your room. I do not agree with teens or preteens having phones in their room overnight because that's when they see things that cannot be unseen and there's no check. There's no health check right there. So a girl who's feeling ugly one day sees just the right post about body image to lead into an eating disorder. A girl who just got kind of snubbed by a boy and is feeling ugly and sees her group of friends out just at the right time, that can be really catastrophic. And so like
so triggering.
It's so triggering and they're all alone in their room and that's when they're consuming it. And teens' frontal lobes are not developed fully. So in their mind, and this is very normal, I tell parents of teens this, their whole thing is their friends. What their friends think trumps what their family thinks. It's everything. And that's just a normal part of teenage life. But when they see that social media post and those friends are out, it's not just a snub. That's literally the end of the world. Or their boy out with another girl or, you know, the eating disorder hack. Those things take over. And that's why social media scares me because it's when they're consuming it and it's never with supportive people.
That's so true. I mean, I agree with you 100%. Just as a mom of girls, luckily
you're a girl
we
mom.
kept it to a minimum in our household, which I'm really grateful for. And you know, my oldest was a bookworm, so I really didn't have too much stress. It's just as a parent, as us, our generation of parents trying to navigate this space and help our kids with something that we grew up without.
We don't know.
It didn't exist.
We don't know how to do it.
You know, I went to a school the other day to do senior portraits And the library, there was no books in it. It was a media center. And I'm like, we used to have the card catalog in Encyclopedia Britannica. I was just looking around like, oh my gosh, the world is so different now. And just us as parents, we're struggling too to navigate all this. And it's like, you want to, okay, let's cut down your screen time. Let's do this. Let's do that. What can you say to us parents who are trying to help our teens with dealing with this situation that we didn't even grow up with?
Well, I think you said it really well. We don't know what we're doing, so we have to be easy on ourselves and say, I'm going to do it one day at a time. And also tell the teens, like, you're not in trouble for wanting to be on social media. All your friends are on it. But let's talk about it, because once you see something, you can't unsee it.
Right.
And so if you're a young kid and you accidentally see a pornographic image, that's in your brain. Mm-hmm. If you're seeing something like sometimes TikTok will show lives of people, dying. You can't unsee that. That's going to create a traumatic event in your mind. Mm-hmm. So I guess educating them on saying, here's a safe way to use it, because we're not going to get them to stop.
No, we're not.
But the schools have started not letting them have it in middle school, which I do appreciate. But
very good.
I'm holding on as long as I can without letting my son, he's 13, have social media, and he asks me a lot. I'm going to have to give in eventually, but it's hard. Yeah. And then the adult piece is that women, let's be honest, we see, like you said it earlier, we see a post and we compare. Mm-hmm. And 40-something women, we already feel like we're going through a lot. And then we see a group of girls out to dinner and you're sitting on your couch in your sweats and you're like, I'm just a loser. I don't have anything to do. And you're just, in that moment, you just get brought down and your mental health just plummets. But you don't see anything that's going on with those people.
Right.
That's a highlight reel.
That's what I always, yes, I've said that so many times. I say it all the time. I'm like, this is a highlight reel of somebody's life. Do you think they're constantly in Cabo on vacation?
Exactly.
No, they got back after a week and went back to work and went back to their regular life. That person you just saw at Cabo on the boat is now at home baking chicken. Mm-hmm. Calm down. It's just a highlight reel. It's just fun stuff. It's just little blurbs. Hey, look, we did this or we did this. It's just pretty pictures. Just see it as like a TV show. Yep. Like, don't even picture that as a real life, because it's not. And you don't see everything that's going on behind the scenes. For one, because it's none of your business. But for two, because it's just someone's vacation pictures. Yeah. You have to just, I hate to say it, but take a chill pill.
They're not going to post the fight they had with their husband last night.
Absolutely not. Absolutely not. I mean, and boy, yes, there have been some rounds.
Yes. And that would be a whole nother social media.
Exactly. Can you describe some of your approach when working with like different age groups?
Yes. So I love working with kids. Kids are so fun. They're so honest. With my little kids, I love just kind of getting in there and getting on the ground and playing with them, because they will be doing Legos and I get them relaxed and they'll just talk. Oh. They'll just, la, 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 la. They don't even realize what they're saying, because they're kids. They're not meant to be fake about anything. Mm-hmm. So once you build that rapport with the kid and you say, let's do a puzzle, let's play, let's color, they will open up as long as they feel comfortable. Mm-hmm. And then teens, a lot of people are afraid to work with teens. And here's why I like teens, because teens will tell you like it is. And once you break that little shell, they're going to keep coming back and they're going to keep telling you things. And the biggest thing I can tell for teens is like, everything here is confidential. Mm-hmm. I'm not going to go say all the stuff that you told me to your parents. So this is a place to get it out where I'm not your friend. I'm not going to say, oh my gosh, like this is how I would have done it. I'm just here to listen. And so teens actually are very honest once you give them that space. Mm-hmm. And I've actually had a lot of teens just sit there and we just chat about school, and then something will come up and I'll be like, tell me more about that. And they'll be like, and it's a whole tangent. They want to talk. They just sometimes think that you're out to get them. Mm-hmm. Like their parents made them come to therapy.
Yes. Sometimes, yeah, I could see that 15, 16-year-olds feeling like, the world is,
Yeah, why would you want to talk to some stranger?
Yeah, exactly.
But it's actually healthy because you can get it out and you're not talking to your parent who's going to say 30 things after one sentence.
Yeah, because like you said, one of their fears is like being judged by friends, or it's like the judgment.
Yeah, the judgment. And I'm here not to judge. I'm just here to listen. And you might hear that there might be a solution to that. So, with little girls, we'll talk about friendship fires, which is like two friends are being mean to one friend. And I love doing group therapy for that reason. I love getting girls together to talk things out like that. So I think that's a cool way to do it. And then adults, it's just a whole different ball game, because the way I do it is talk therapy. but I also educate adults on things about how to change your thoughts, how to change your behaviors, and we work on more set goals. So I don't know if that makes sense, but
no, it makes total sense. Do you feel like therapy is for like all ages? Would you, I mean, like what's the youngest would you say for therapy? Like
well, that's a good question.
5, 6, what is?
People can do play therapy, you know, as early as 4.
Okay.
I've seen, it's just a different type of therapy because you're getting things out of them in a way. Like say they do like a sand tray and they put we get figurines and they might put a house and mom and dad in the house and dad's over here. And those are the kind of things we pick up on. Or a picture where darkness, you know, there's lines over somebody and you have to kind of know how to interpret those. So a lot of people who are specialized in play therapy, whole different ballgame than adult therapy.
Wow.
Play therapy is really interesting, but it's all about like how you interpret some of the stuff they do. And so that's kind of a cool way to do it too.
Wow. What's the oldest patient or client you've ever had? I'm so curious.
I worked at a domestic violence agency and I had a 73-year-old widow who was in a relationship with someone who was stalking her, domestic violence partner, an ex-partner. She was the sweetest woman. And I still have an angel she gave me for Christmas because she said, "You're my angel." She would come in and she would talk about how this man just basically was terrorizing her. And I think he was after more of like a monetary thing, but they definitely had they had a real relationship.
Wow.
So probably like 73. I mean, and then in the older care facilities, they have people who specialize in geriatric mental health.
Okay. Yeah. I was curious about that.
So that's definitely
it's kind
something.
of a separate type of expertise that you would, okay. How do you handle like different like cultural or diversity issues in therapy?
I love this question because when I was in school, I'll never forget my professor said, "Here's how to handle different diversities. Ask questions." And that has stuck with me because what I always say to people is, I'm here to teach you about trauma. You can teach me about your culture. You can teach me about how you would respond. And I'm not here to teach you how to handle your cultural, nuances, identity. I'm here to teach you about the trauma piece so we can kind of learn from each other. Because you're not going to know every culture. You're not going to know every ethnicity. You're not going to know all the nuances. And so I'm here to teach you one thing, but you're also teaching me. I've taken a lot from different clients. So I think that's such a cool aspect because in Tulsa, Oklahoma, when I worked there, I learned a lot about, the Native American people. And there was a lot of different issues there. And it was just like something I learned and I can take away from that. And then hopefully they learn from me how to handle their trauma.
Gotcha. Okay, that makes total sense.
Yeah.
I love that. Yeah, it's just because it's all a learning experience because it's like even when I don't do anything close to what you do, but just working with different cultures on their weddings.
Oh my gosh.
How different processes go and like different ceremonies. And it's, it is like a learning curve. Like you jump in there, but you want to be respectful of everybody's culture. You want to learn about it. And, working with different like Palestinian brides that I've had and Israeli brides, like I've learned so much about these different cultures. And I'm like so grateful because it's something that like opened my eyes.
Exactly.
It was so eye opening. I'm like, wow, that's amazing. They wear bright colors and they do all these different things and it's so inclusive and like their entire family comes. It's like learning about different cultures is just so beautiful.
And you said the family dynamics on the day of the wedding are very different.
Exactly.
Where some are pushier with their daughters and some are more hands off. So you are, I know people tell you things and spill things in the chair.
Oh, goodness. When people sit down in the chair, that's the thing. I feel like, a therapist, but I'm like you.
We have a lot of similarities.
Yes. I love to ask questions though. I love to ask questions. I remember when you sat in my chair, I was probably a chatty Cathy because it's like, once you told me what you did, I was like, oh,
yeah.
Okay. Now tell me this and tell me this and tell me this.
Exactly.
We talked about so much. I'm so curious. How do you help women specifically kind of navigate through traumatic experiences? Like, I don't want to name like a specific experience, but if you want to give,
that's a great
an example.
Question. So first, I just want to reiterate trauma. People think of trauma as,
physical pain,
a burglary,
sometimes, or yes,
an assault. So I'm going to also just educate really quick. A traumatic event can be witnessing a car accident, seeing someone have a seizure in front of you and it's sticking with you, being in a house fire. So a traumatic event is something that is different for everyone. But my expertise more was sexual assault, domestic violence. And then I did work with kids who had crossed the border from Mexico and they were abused along the way, physically or sexually. So treating trauma is very interesting because there's lots of different treatments, but one of the biggest things is teaching somebody how to remember a traumatic event without going back there physically. So basically, when you remember a traumatic event, it can be a flashback. What that means is your body goes into fight or flight. You might have heart palpitations, you're shaking, your breath quickens, you might just be sitting in a room and a smell gets to you and you go in the fetal position. Or you might literally never go into Houston because something happened in Houston and you can't because it physically debilitates you. So my job as a therapist is to not erase what happened. That happened to you. That's part of your story. What we do is we kind of make it almost a boring story. So you tell me the story in different parts. We work through each part, grounding you. And then you can remember without going into flight or fight. And this is a more simplified way to explain it. But basically, we work each session on, not right away, but telling different parts of the story. Okay. And I will not let you ever leave a session without knowing that you're safe and you're here and you're grounded. So, sometimes therapists who aren't licensed or who aren't trained in therapy, they have them tell the story, but then they let them leave when they're in that flight or flight. And that's the scary place to be. So we have to teach them, okay, now we're going to do some grounding and some breathing. What that means in real life is when you experience that, you will then know what to do. Yes. Because there's going to be triggers in your life that happen all the time. Yeah. Now, the people who disassociate, you might hear people say like, I remembered something later in life and it just hit me. Because sometimes with trauma, you feel like it's happening to somebody else. And they describe it as like you're watching a TV show and you're watching it happen. The problem with that is you push the feelings, they eventually show up. But what happens later in life is you don't get to choose when they show up. Also, you don't know what to do with those. So you might start feeling them and you turn to alcohol because you're like, the only thing that helps me is this bottle of wine. The only thing that helps me not think about this at night or not have a nightmare is a Valium.
You start to have those crutches.
Yes, it's a coping mechanism. So we want you to get into therapy instead of pushing it down to say, I'm going to control when I remember this and what I do. Because as much as you try to push things down, they will come out.
Yeah, we'll resurface.
They'll resurface. You don't know when, you don't know how, but our mind is strong and it'll come back. So we teach you how to handle it on your own. Yeah. And I'm a fan of survivor groups. So I ran a domestic violence survivor group where it started with like 5 women and then we ended up with like 15 women. And I ran the group from a therapeutic perspective, but by the end of my group, they were just a unit and they were there for each other every week.
They had bonded.
And I went on maternity leave and I said, okay, my replacement's going to take over. Not one of them showed up that next Monday. They went to the Waffle House.
Oh, and just talked to each other.
They took it off. They took it off book. But I was proud of them.
I love that for them. And they're like, we've got this.
My friend's like, no one came. I'm like, sorry.
Yeah, but you gave them the tools. Yes. And so they felt like they could kind of go it on their own until you got back. I love that.
Yeah, and they were there for each other. They had each other's backs and they knew that they weren't alone. And one girl was 54 and one girl was 19. And it was just a cool. So I really believe in those kind of therapy groups. I think those are great if you can find those.
And I love that there were all ages.
Oh, yeah. And all ethnicities.
I love that.
People who would probably never be friends in real life.
Exactly. I feel that, it's something that you can bond over, honestly, traumatic experiences because it gives you that feeling of I'm not alone. It wasn't just me.
Yeah.
I didn't do something wrong. It happened to her and her and her. It's not something that I did or I put out in the universe that I deserved this. Do you know what
Especially
I mean? Sometimes bad
violence.
Things just happen.
And you're not dumb.
Yes, and we need help with coping with them.
Yes.
Yeah.
And you're not gullible for falling for an abuser. They all compared their narcissistic partner and they found so many similarities. I'm like, see, this happens. Because they say, I feel so foolish. How did I see it? Well, these 4 other girls felt the same thing.
Exactly.
So that's why those things are very powerful. And then there's a support group. A support group is somebody who is a group like an AA group. It's run by a community member. So not necessarily a therapeutic person. A therapy group or a counseling group has a person who's trained in case somebody does disclose suicidality or something like that.
Okay. Gotcha.
So there are differences between the two when you're looking.
Okay. That makes sense. Thank you for clarifying that, because I would definitely not have known that.
Yeah.
I will say I have a really good friend, and I remember it's been years ago, but she went to the movies with her dad and her grandpa, and there was a war scene in the movie, and her grandpa like falls out of the movie seat on the floor, and he just like starts like convulsing, and they had to like call 911, and it was very triggering for him. He had a traumatic experience, sent off to war at a young age, had seen so many horrific things. And even watching it on a movie screen, it just took him out. They didn't know what to do.
And that flight or fight took over. He thought he was in danger.
Exactly. He did.
His body did not know. His body was responding, even though his brain was saying, it's a movie, but his body reacted physically. And that's why therapy is important, because when that started coming on the screen, there's things you could have done. I need to start breathing. I need to walk out of the room. This isn't good for me. This isn't safe for me. But combat veterans of that age, they did not get mental health treatment.
Exactly.
And that's scary. And that's sad for them, because a lot of PTSD in veterans can be helped. And that's the other thing I want to say. Kids and teens are, if people are listening and they have been a survivor or they know a survivor, kids and teens are very resilient. And so if you do have a child that's been a survivor of trauma, get them treatment. They are so resilient. I've seen the most amazing responses to therapy. You just got to get them to therapy. Yeah. Because they will move past it. And it's pretty amazing to see.
So do you think therapy is a lifelong commitment? Is it something that you do like once a week for the rest of your life? Like, do you know what I mean?
Yes, no, I totally get it. Because I have clients ask me that. It depends on the type of therapy. Okay. So if you're doing like solution focus, which is, I want to get through this, we'll have 9 to 12 sessions, we'll hit the goal. But I do believe it's a lifelong commitment to have check-ins and to have somebody that you can get a hold of. The only other thing I will say is sometimes people go to therapy, they get better, quote unquote better, then they just stop because they feel better. Okay. And the problem with that is they weren't quite ready. And so when it gets bad, you don't have that weekly support. Sometimes I would have clients that would try to come every week because it was just, I was their social interaction. And as hard as that is to make my boundary, I had to stop because therapy is not a substitute for social interaction. You still have to go out into the world. You still have to meet peers. And I'll tell people, I can be your friend at a coffee shop and tell you what you want to hear, or I can be a therapist and tell you the hard stuff. Because a friend at a coffee shop's not going to challenge you. So sometimes people do treat therapy as a lifelong thing because they just need that companionship. But the problem is that can't be a substitute for that because that's not a real friendship. Ethically, it can't be. Right.
So are there, okay. I'm trying to word things properly.
I get you.
Are there multiple therapy styles?
Yes.
So like, would I see a therapist for this type of trauma? Do I see a therapist for this? Or is it more about a treatment plan or a treatment system?
No, that's not a weird question at all because there's so many different things. So first of all, there's different treatment styles. So like people get trained in CBT, which is cognitive behavioral therapy. That's what I like to do. Okay. It's changing someone's thoughts and behaviors. But then there's also, if you want to get analyzed and talk about dreams and talk about your childhood, you could do a psychodynamic counselor. Okay. That's a different background. And on their website with therapists and on Psychology Today with their blurb, they will tell you what kind of therapist they are. Oh, okay. So you can know what to look. And I have people calling me all the time. Can you help me find a counselor for this? I will say like anxiety, depression, trauma, most counselors can treat those things.
Okay.
Trauma counselors, trained in trauma focused CBT, which is what I'm trained in. We are a little more specialized because there's a protocol we follow. Mm-hmm. And I would suggest that for like children with sexual assault, children with, assault and battery, things like that, because it is a very specific with research shown. Mm-hmm. But there, you go to school and you learn different styles, but then you kind of adopt which one you want to do.
Okay.
And then there's also people who specialize in EMDR, which is eye movement. Have you ever heard of that?
Mm-hmm. Yes.
EMDR helps with trauma, but you have to be certified in that. Mm-hmm. So yeah, I mean, it's a great question because if you wanted to do marriage counseling, that's a different therapist.
Right.
Family counseling, different therapist. And then there's people who want to do the long-term, and that's more psychoanalysis, kind of what you see in the movies.
Okay.
It's not as common now, but people still do it.
Okay. I was just curious because, as a layperson, when you're trying to navigate this world, you're trying to figure out, okay, well, what kind of, now there's different kinds of therapists. What kind do I need? This is what I've gone through. I mean, is it normal to like kind of interview different therapists and like book multiple sessions to try to figure out, it is normal to see who you're comfortable with?
Because people think they're going to hurt someone's feelings if they need to switch therapists, and they're not. It's like finding a hairstylist that works with you.
Okay.
If you don't gel with that therapist, that's not going to be a good therapeutic relationship. I do have a caveat to that.
Okay.
Most people who go to their first therapy session, you're not going to love it because that therapist is kind of itching that wound a little bit. We're scratching. Mm-hmm. It doesn't feel good. Mm-hmm. It might feel great because you're, okay, I feel normal. But if you're doing like a trauma or a depression where we're challenging you, I will say to somebody, give it more than one session before you decide on the therapist, because the first session is hard because you're talking about things that you might have never talked about before. Mm-hmm. And we're going to push you. But I would say after 3 sessions, if you really just can't connect, it is totally okay to go to somebody else. Mm-hmm. And when you call the therapy office, the intake person will interview you and put you with the right person.
Oh, okay.
So an intake coordinator is literally there. And I think it's really hard for people, like you said, a lay person, to know where to go and like what kind of counselor to do.
It's intimidating. You see all these terms and things you don't quite understand, and you're like, look, I really need somebody to talk to, and I don't know where to begin.
And you don't know who can give meds, and you don't know who can work with who.
Exactly.
And so you have to ask questions. It's how else would you know?
Yeah. What's your thoughts on online sessions versus in person?
So I think they're very helpful for people who need the online sessions because it's easy to book. You can do it. You don't have to leave your house if that's something that's really hard for you. I'm glad they have that. I don't feel as comfortable because I wasn't trained on a Zoom session.
Gotcha.
I love being in the room with somebody, reading their body language.
Yes.
You
have to pick up on those cues
into that.
And it's harder to do.
And even like seeing if they're well groomed. And what that means is like on camera, you can't see everything, but someone who's going through depression maybe isn't taking care of themselves and maybe isn't looking like they usually look. And that's all the tools that we need as therapists to see.
You need to put all the pieces of the puzzle together. So
I think it does work. I just think some counselors and therapists are more comfortable with that. And I think that it actually opens the door more for people who wouldn't get therapy. So I am a fan, but you also have to be in a room without distraction. I've tried to counsel someone in a car and I'm like, I can't see your face. And this isn't going to work, and they do have text counseling now. They have phone counseling. That's a whole different thing. But you know what? It's better than not talking to somebody.
Yes, it's better than nothing at all.
Yeah, it's better than nothing at all.
For me, I'm an in-person, in your face, like talk to me, look at me, listen to me. Yes, I'm trying to convey something. I'm very animated. For me, it would have to be in person.
Yeah.
I don't think I could be online on the phone. Someone just asking me, how are you feeling today? I don't think I would deal well with that, but I know there's different personality types, but for me personally, I don't think it would work.
And you don't get to see someone's social skills. So if I know someone's having a hard time with work, I could say like, hey, I noticed that like you don't want to make eye contact a lot. Maybe that's something that comes off as standoffish. But also that was back in 2008 to 2010 when I was trained, online therapy was just starting. So maybe now people are getting more specialized training in that. But like you, I think we're alike. We like the in-person.
Yes.
Look at your job. You're in person all the time.
Yes.
You can't do makeup over Zoom.
Absolutely not. Absolutely not. Unless I'm teaching a class.
Right.
I totally get it. Can you kind of describe just like a mild treatment plan, what a plan looks like?
Yeah.
Or like one of my friends, she's like, oh my gosh, my therapist gave me so much homework this week. What is the homework?
Okay. So treatment plans are really cool because it's like a way to measure what you're going to do over the next, it could be weeks, could be sessions, but it first starts with your goal. So Chantel will reduce her PTSD symptoms by 20% in 20 sessions. And how do we measure that? We have questionnaires that are therapeutic where you fill out how you're feeling. And those questions are studied and they're official, psychology questionnaires. And so we hope by the 20th session, your symptoms will have gone down. So that's your goal. We start with that. Goal 1, Chantel will attend one group therapy session a week. So that's goal number 1. You got to get to the group session.
Okay.
And we do it together. It's never the therapist saying this is what you have to do. It has to be collaborative. Number 2, someone who has depression, one of my biggest things, go outside and walk around your block once. If you can't walk around your block, walk down to the driveway. And then by the 20th, I want you to walk twice around your block. So you're doing goals. You don't want to make them too big because then they get defeated.
Yes.
Number 3 goal could be something like write letters to 3 different people this week that you are not going to send, that you need to tell them things. And that's the homework.
Gotcha. Okay.
So for my domestic violence clients, I loved this one worksheet. It was write down your non-negotiables for your next relationship, things you're not willing to put up with. You can name a lot.
Yes,
if you put them down, but you don't realize how many there are until you actually write them down. So like, I will not settle for a man who asks me to see my phone. That's written down. So for your next relationship, oh, this is a non-negotiable for me. So those are the homework pieces. And then the goals are things that you're going to do and you're going to commit to doing. And then I'm going to help by educating you on, hey, let me tell you some symptoms of trauma, and I'm going to educate you so you know what to look for. So that's kind of and then you can always adjust it. If you're like, hey, I'm not getting it, or hey, I can do more. But I think I'm a big fan of the homework. Clients don't always like it, but when they actually sit down to do it, it's like write a letter to someone saying everything you want to say and bring it to me and don't send it. You can write a lot down.
Absolutely. Could be a good solid 10 pages before you know it, because you have so much inside that you need to get out. And it just feels like a release.
Yep.
It's just that release. It's like you got that energy out of you. You put that energy into the paper, and now it's going to help you let it go.
Yep. Yeah. And you'd be surprised how much people pleasers we are. When we go back to therapy, we do the goal because we don't want the therapist to say, okay, did you walk 3 times? And you say, no. You want to be able to be like, yeah, I did. And yeah, you can lie, but that's not going to help you.
That helps no one.
And I also like to educate them on, hey, here's some coping mechanisms that people do after a trauma. Drinking too much, taking drugs. And then one for girls, because you talked about girls and women. People don't always know this, but with sexual assault, one of the coping mechanisms can sometimes be risky sexual behavior. So educating girls on, hey, this might have been how you thought love was conveyed. So this is all you have to give in your mind. So a lot of unprotected sex. Risk of STDs, risk of pregnancy, and then risk of re-victimization. Yes. So my girls in my old job, I would be like, we are going to talk about how to stay safe at a party and how you don't go upstairs with him. You don't just go have sex because that makes you feel loved at that moment, because that's how they felt loved before. Right. So that's a really big thing that I don't think everybody knows about, that risky sexual behavior can be a coping mechanism after a sexual assault. Wow. So I love to just give you that information in session and even maybe have you read a book about it or have you read some facts about it so you know.
I love that. And I think we need to reiterate too, like talking to your therapist, it's confidential. It's not something, and even for the teens, I think they're probably afraid like, oh my gosh, I told her this happened to me at this, party, and she's going to like, as soon as I leave out of this room, she's going to go call and tell my mom, because I feel like that's when you're not going to get the truth. Right. You're never going to get to the heart of the matter of what's really bothering them if they have that fear of I'm going to be in trouble or being judged and things like that. So I just, because I think a lot of people think that it's dinner conversation when you leave work.
Right. And it's not.
And it's not. It's not that way.
And you can say, I like to train people when I was training, say something to the teen like, I'm so glad you shared that with me. Mm-hmm. Thank you so much for trusting me. And that is going to stay between us. I know you think that that's like something horrible you did, and we'll talk about why you did it. But guess what? You don't have to feel shame because you slept with this boy where your mom would literally go crazy. And I'll be like, thank you for trusting me. Mm-hmm. And let's work on why you did that.
Yeah.
And then they can walk out of there being like, okay, I'm not a horrible person. I'm not full of shame. And we'll say like, there's a reason you're doing stuff like that because that's making you feel validated. Mm-hmm. And I think that's a big thing with teens. But there are, 2 times when you would have to break confidentiality, and we can go over those if you want to.
Yes, please.
So this is not just for teens, but anybody, if they disclose they're going to hurt somebody else, mm-hmm. and if they disclose they're going to hurt themselves. Okay. And I'm not just going to call 911 if they say I want to kill myself. What we do is we go through a protocol, mm-hmm. talk about, do you have the means? Do you have something? Do you have a plan? Mm-hmm. Do you have a social support you can call? And then we actually make a safety plan. And if they agree to the safety plan, they can now if they're under 18, you have to tell their parents. Okay. But for an adult, we make a safety plan and we really put it into place and we kind of make a commitment. And if they will not agree to that, that's when you would have to go to the next step, which is, maybe getting them to a facility that they would be safe.
Okay.
But suicide is something you have to talk about with trauma because it's just something that can happen.
Yes, it is.
And it's not a dirty word to say. It's actually good to check in. I tell people, if you feel like a friend is down, it's not a bad thing to say, are you feeling like you're going to hurt yourself? Mm-hmm. Because that's not going to implant in their mind if you say that. Some people are afraid to say that because they think, oh, I'm going to give them an idea. Trust me, you're not giving them that idea. People have the idea or they don't.
Right.
But it's not a dirty word to say. Mm-hmm. Are you thinking about it? Yeah. Because they might be like, yeah. And you can talk about it.
Yeah. I remember just like growing up, you'd watch certain sitcoms and they would have a serious episode, and then after the episode, 2 of the actors would come on and say, hey, if you've ever felt this, or if you know a friend that's going through this, give them this number, help save a life, give this suicide hotline. And I remember, watching things like that, growing up, because I feel like in our generation, our parents weren't putting us in therapy. We weren't in therapy. Those 1-800 numbers may have been all we had to call, to go to a payphone and call that number and get somebody to talk to because you may be going through something at home that you can't share at home. So I really like that. I feel like this younger generation, like my kids' age and stuff, they're very comfortable coming and saying, look, I need to talk. Mm-hmm. Like, I have to vent. I need to say this. And I can say that, as far as myself and my husband, I feel like we've done a really good job because our kids tell us too much.
Yeah. But that's a good thing.
Yeah. They tell us, that's where we always tell them, like, if they don't feel that their home is a safe space, then where are they going to feel comfortable if they don't feel comfortable at home?
Right.
So we always made it a point to never shame our kids about anything. If you want to tell us anything, we're open books. You can come and say anything, like great. Just let us know what's going on.
And you're not it's like you said, you're not going to shame the person. First, you say, thank you for telling me.
Yes.
I'm so thankful you told me. Second, you say, let's figure it out together because nothing is too big for me to figure out with you. And I try to say that to my kids. There's never going to be anything that's so big we can't figure out together. Mm-hmm. And yeah, that last thing could be suicide. Because like I said before, teen brains are not fully functioned to the point where they can think everything through. So that impulsivity is really scary when tied with depression and trauma.
Wow.
Because they do not realize how final that is.
Yes.
And
that's what's very scary to me. They don't understand the finality of it.
They don't.
For them to believe that that's an option, it's like, I think they're in that frame of mind, like, I just need this situation to be over, but you're ending everything.
Yeah. And most people would, there's a man that's very famous. I don't know his name, but he survived jumping off the Golden Gate Bridge.
Oh my gosh.
And he goes around and talks to people now about suicide prevention. And he says the second his feet left the bridge, he regretted it.
Oh, wow.
And he said, I just want people to know that second I was like, what am I doing? And it was too late, but it wasn't too late for him. Mm-hmm. But that's not always the case.
Yeah.
So I make it a point to talk about suicide because I think it's a very scary topic if you're not in the mental health field, but it's also like, let's talk about it because then other people will talk about it.
Yes. And it takes some of the stigma away. It takes some of the stigma away if you've had those thoughts. It's like, you don't need to be ashamed that you had those thoughts.
And and I always tell people, just because you've had the thoughts doesn't mean you were going to do it.
Exactly.
It just means you have thought about it. So the next line of questioning, okay, well, would you have a plan? And most people say no. But if they do, okay, is there a firearm in the house? Like, let's get it out of the house. Are there pills in the house? Let's talk about it. Let's do it head on rather than just beating around the bush.
Right.
Because, and that's an important thing to do. But I think sometimes people just, like, some parents don't even want you to talk about it with their kids. Just like they don't want to talk about sexual assault. It's like, you really need to talk about this stuff because this is the world we live in.
That's the thing. It's the world we live in. And I feel like you have to be a sounding board for your kids. You have to, if you're married, you're a sounding board for your spouse.
Right.
Dealing with work stress and different things like that. There may be things you're like, okay, well, wait, honey, we got to call somebody because I'm not equipped to help you with this situation, but I can at least listen. At least listen to, especially the teens, please listen with an open heart and an open mind and try, as hard as it is, try to not come from a judgmental place, because the minute you start doing that, I feel like they shut down.
Yes. And one of your questions on here was, attributes of being a counselor.
Yes.
One of the things that's really important that I learned early on is how you respond when someone tells you something really bad or really shocking. So the smallest micro movement in your face will let a kid know, I've just said something really bad and I'm going to stop. So one of the cool things we do in trauma-focused cognitive behavioral therapy is a child will do their whole story of what happened to them over weeks. And then I bring the caregiver in and we read it together. That's when you can cry. That's when you can say, oh my God, this happened to my baby. That's when you can freak out. The next session, the child comes in and reads it, unbeknownst to them that you've already read it. They read it to you and you will respond appropriately. So at that moment, you're responding without the shock, without the tears. And you're just like, you're so brave. Thank you for sharing that. And that's how we get around.
That's amazing.
Yes. That's why I really believe in that trauma-focused therapy, because that caregiver's already had time to process. And that's okay. You're going to process that. It's your kid.
Yes, of course.
But that's an adult session. So when the child says, okay, I'm going to read my story, they have no idea you've already read it. And they're going to see your face going, you are so brave for sharing that. And we're going to get through this together.
Wow.
And so as a counselor, I've heard some shocking things.
Oh, I'm sure you've
things
heard
that I'm like,
so much.
Wait, what did you just say? But you really learn to kind of say, okay, tell me more. And that is why you have to, know how to handle that. And then also in graduate school, I will say it weeds out the people who have issues that they cannot get past. So what that means is, say you've been cheated on and you're a marriage counselor and you are doing your practice internship, because you're not allowed to counsel people until you do your internship, and you realize every session I'm just angry at the husband.
Wow.
Even though they want to try to work it out. That's called, you can't get past your own biases. And that's okay. That's normal, but you have to realize that before you go into the profession. Or maybe you can't handle trauma because it takes you back to a dark place. And graduate school is 2 years plus a full year of internship.
Okay.
And there were people who did not complete my program.
Wow.
Either they were asked to leave because they weren't saying the right things. They were saying things that would be not helpful or almost, bad. And then people who just said, you know what, this isn't for me.
Yeah.
So I think the training program really helps you to see if this is something you want to do. I know I couldn't be a nurse because I would have a hard time seeing like the gore and the stuff from car accidents. And people tell me, I don't know if I could hear that story. Okay, well, that's good skill set you have, and that's a good skill set I have. So I think that's important, but it's how you react to someone telling you something. They'll see it in your face, and they'll shut down if they see that you're like, oh, that's weird, or oh my gosh, because everybody has their own stuff.
Right, exactly.
So.
And you have to check it. You can't bring it into these other people's lives.
Check your
this
check
is
your
their
own beliefs.
Story, not your story.
Yeah, you might not believe in their lifestyle.
Right.
But that's not your cross to bear.
Right.
So that's why I think counselors and therapists have to be very careful how they react. And that's why we teach parents when they tell you something, just watch how you react because they will shut down.
Absolutely. I feel like the people in your class, for example, I feel like they went in with the most wonderful intentions.
Of course.
And then they just, then you just realize, oh my gosh, this isn't for me. Let me pivot. But I just feel like the thought that they went in with wanting to help people
yes.
is noteworthy.
It's very noteworthy. And I think it's noteworthy that they stepped down.
I do too. Like how brave to go, oh my gosh, I put in all this time, effort, energy, money, like financially what this cost me to in the end have to say, I'm not the best help for these people. I have to pivot and do something else. That is a very brave decision to make.
It's very brave. And it's humbling.
Yes.
And it's just like a doctor who drops out of med school because they're just like, I can't handle it. And so I think that's why going to a therapist that's trained versus like somebody who's not trained in things, that's the difference. We go to a program that weeds the people out that maybe shouldn't be counseling. That doesn't mean they're not a good person. But there's a lot of people who are touting that they can do mental health, but you just always want to make sure they're trained.
Right.
Because that's your mental health that they're working with.
Exactly. This is your mind, your body, your spirit. That's a lot that's entangled together. And you want to make sure the person that you choose for you, that you're 100% comfortable with them, you can open up, you can share, and that they are trained to help you in specifically what you need help with.
Right.
I think that's super important. What are some things that you can kind of tell us, any tips to help us just like cope with everyday life and stressors?
Oh gosh, that's a good question because there's a lot of stressors in life right now.
Yes.
And my thing is that I never realized I was like into like the breathing exercises or muscle relaxation, but now that I've learned them and I teach them to people, I find myself using them. So for instance, there's something called progressive muscle relaxation. And all it is that you go through each part of your body and you like squeeze. So I'm squeezing my fists and you count to 5 seconds and then you relax. And what that's supposed to do is teach you what it's like. You might be going around all day tense.
White knuckling.
Yes. So then you relax and you're like, oh, that's how I'm supposed to be. So I'll just in the car sometimes just like squeeze and relax and show myself this is the relaxed state. This is the unrelaxed state. And then one of the biggest things too is just, it's so hard sometimes to get motivated, but exercise is dopamine.
Yeah.
It's endorphins, it's dopamine, it's a natural high. Even if it's walking once around the block with music, I'm telling you, it will help your mental health more than you know. Walking on a treadmill, start slow, but walking, running, whatever you choose, that is a natural thing you can do. And there's nothing that can actually match that endorphin drop. And then as a mom, I would say my biggest thing is that I'm telling clients is to step away. So if you are in the thick of it, the noise is bothering you, because I'm a mom of 3 boys.
Oh, girl.
The noise is triggering. The noise is triggering. And I know that now. I will literally walk into my closet and just stand there for like 4 minutes.
That was my space when my kids were little. Girl, the closet. If I was in the closet, my husband knew, oh, she's in the closet.
I need to walk away, or I'm going to say something or scream. And I'll put my headphones on sometimes and listen to like classical music, and I just need to reset. So instead of like being in the moment, just walk away. They're going to be fine. They might be yelling your name. Shut the door. Yes. But we have to realize that it's okay to step away, because you're actually not Superwoman. You're not Superman. You can't do it all if you're having all that stuff in your head. So you have to know when to walk away. And it doesn't take as long as you think.
Yeah, just a minute or two, just a few deep breaths, just to collect yourself. And like you said, unclench your fists and be like, whew, okay.
Right.
Okay,
exactly.
now I can walk back in there.
And knowing what times of the day that's going to happen and preparing for it. Because I know between like 4 and 7, I'm the most irritable because that's when they want 50,000 snacks. I'm trying to do homework.
And dinner.
And even if I can take my advice to say, I'm going to run the dog around the block for a second. That is what I need.
I need it.
Yep.
And I feel a difference in myself and my own mental health when I don't have time to throw my dogs in the stroller and go around the neighborhood. I feel different. When I go to bed at night, it takes me longer to fall asleep because I have too much in my brain that I didn't work out that I normally work out on my walk. because now I'm thinking about, oh, wait, I need to rearrange this appointment. I needed to do this. And normally I've worked that out on my walk, come home, taken a shower, and been able to go to sleep.
Yeah, and you're tired.
Yes.
Naturally tired.
I wake up exhausted. Absolutely. That's 100% true. And I do have that feel good, that dopamine that you were talking about. Absolutely. I feel it. And it's like, but I'm walking around like, even though I'm working things out in my head, I'm playing a podcast. Like I love to listen to Science Versus. Like it's going on and I'm listening to that and I'm working things out in my head. And I'm just like walking around all the duck ponds in my neighborhood. And it does so much for my mental health. It is.
That is your self-care right there. You just defined it.
Yes.
For you, it's walking your dogs in the stroller, listening to your podcast.
Yes. And my spouse notices. He'll say, oh, you need to go for a walk.
Yes.
He'll tell me,
I love that he knows that.
You need to go for a walk. Like you haven't walked. You normally walk. You used to walk every day.
Yes.
You've only done it twice this week. You need to go walk. Yeah.
And sometimes people think I am not like a big like CrossFit or like I don't.
Oh no, I'm not flipping tires.
You don't
outside.
You don't need to. When I say workout, you don't need to go do.
It's a stroll.
Yes.
A stroll on the duck pond. Go throw some crackers at the ducks.
Yeah.
Some Ritz crackers, crumble them up and go feed the ducks. It's so peaceful.
I'm glad you said that too, because actually going outside and grounding yourself, literally touching grass, is better than you will ever realize. Put a coat on if it's cold. Go outside and breathe in the fresh air. That vitamin D will hit you. Do not go outside at least once a day, because that changes my mental health. And I'm like, oh, it's cold or it's hot. But like vitamin D, we need it.
Yes.
So I know it sounds simple, but it's the only way we can get a certain kind of endorphin drop. You can't get it from anything else. It's scientifically proven. Like that is a very specific feeling.
Yes.
But you don't have to be a CrossFitter. Go take a walk.
Yes. Just I just can't stress that enough. A simple walk. And for me, it can't be the gym. It has to be outside. I had the gym membership. I'll jump off the treadmill, go get a smoothie, start watching TV. I was accomplishing nothing. If I wasn't in a class where the instructor is up there saying, do this, now do this move. If it was just me left to my own devices and it wasn't a day when I had class.
No, we're the same person. I'm the same.
I had to cancel the membership. I'm like, not using this. All I'm doing is buying smoothies and they have pedicures in here. I'm getting pedicures and drinking smoothies. Like, this is not good. I have to go outside and put on my little Apple Watch and do my 5 miles and listen to 2 full podcasts and, just do all the things. That's what works for me and my mental health. Yeah. I really feel like that has helped to keep me sane.
And like knowing that that's what it is, that's the biggest step. It doesn't have to be complicated.
Not at all.
And so you don't have to have the money. You can just walk. I mean, that's the thing. So we're very alike in that way. Because I'll get off the treadmill and be like, oh, I better go do my laundry now.
One last question, and then I'm going to let you go, I swear. What are your thoughts on journaling?
I love it.
Okay.
Journaling can help you get it on paper, say things that you even haven't said to yourself or your therapist. But the thing about journaling is, even if you write 1 sentence a day, that's journaling. So 1 sentence when you wake up in the morning, it's like, today I'm going to do this. That'll turn into more thoughts. So I think journaling can be really like exercise. Like it can seem intimidating at first. Like I have to have like, dear diary today, but really it's like, it's actually something really helpful because you can look back and see how far you've come. And I tell people, if you don't like the word journaling, write letters. So you can write a letter to yourself. Like, dear Lauren, today was not your best day. Here's why. So you can do it however you want. You can do it on a computer. You can do an audio journal, but get it out. When you get it out, it's not stuck in your head. I'm a big fan of journaling. And I tell teens a lot. And I don't use the word journal because they feel like, I don't want to journal. I'll just say, type it out. Just type it out on a Word document. Just like put everything you want to put out. And they'll do that sometimes. Yeah. Or like a collage or something. But like getting it out of your head and onto paper or into the world frees it. Even if you never show it to anybody. Yeah. Well, it's just, I'm 46, grew up old school. You had your little diary. Oh, yeah. With the little lock on it, and you'd write your little thoughts down. My mom made me mad today. And then you close it up. I hated what we had for dinner. I wanted spaghetti. We had this. Your little. My crush is so-and-so. Exactly. And so I think it was a part of our culture because we didn't have anything else. So we were used to writing our thoughts down. But nowadays, trying to get them to like write down thoughts, they don't even have worksheets at school. They just do everything on a laptop. So getting them to physically write something down
is harder.
And they'll say, oh, I just text my friends, but I'll say, no, that's not.
No, it's private.
You have to say things that you're saying that you didn't say to anybody else. So you're not, okay, act like you're texting yourself then, but put it out, not to somebody, because they think texting can replace everything.
And it does not. These kids have strong thumbs nowadays.
I know.
Their thumb game is so tough. They're like the video games and the phone.
And they don't know how to call people.
They don't know. They do not know how to have a phone conversation.
That should be in school, like how to call, make an appointment, how to do all this, because
how to sign your name, because a lot of these schools don't teach cursive anymore.
Yeah.
So we had to teach our children how to sign their names. Granted, you don't use them anymore, but this is how you fill out a check. This is how you write a check. We know you don't really use this anymore. You have a debit card, but you still need to know this just in case.
Idea.
Yes, it's like you have to give them those life skills because that's not a part of school, But
everything is digital.
Yes, exactly. And they need to know how to live in like the real world.
Yeah.
Even my son, I'm like, okay, do you know how to pump gas? Here's the card. Go pay at the pump the gas, get the receipt, like just these everyday little life skills that they need. I just think it's so important. Yeah.
Social skills too. Like you're texting all the time. So please look people in the eye. Please look up from your phone. I think phone etiquette is something we need to teach, like at the dinner table.
Absolutely.
So there's a lot of things, and it's not the teens' fault.
Right. It's the era they grew up in.
Yeah, they're growing up with phones and we didn't. So we're all learning together, just like I said with the other stuff. We're all learning it together, but it's going to be a long journey.
And that's it right there. We're going to end on the long journey.
Long journey.
Lauren, thank you so much. This was an absolute freaking pleasure.
Oh, I'm so glad. Thank you for having me.
I'm so happy you just kind of let me, pop your little podcast cherry.
I love it.
And you were able to come and share this time with me. It truly meant so much to me. I'm just really happy just to talk about therapy and mental health and just kind of help remove some of the stigma, because you're not weak for asking for help. So please don't ever think that. If you need it, you need it. If you're looking for someone impartial, non-judgmental, to just help you cope with whatever it is that you're going through, don't be afraid to reach out for help. And I think a lot of people don't even realize, with your different support groups that you can find, that you can research in your area, that target certain things. You were talking about how there are specific ones for each thing. Find one in your area. Yeah, find one in your area.
And therapy is not scary, I promise. We're nice.
Yes.
And we know it's intimidating at first, so we will go at your speed.
Yeah. I love that. I love that. Thank you so much again for coming. Thank you guys for listening. We hope we helped you today, and we wish you all good mental health. Bye.